Hey there. If you're watching this video, chances are something doesn't feel quite right in your life. Maybe you're exhausted despite getting enough sleep. Perhaps your strength at the gym is declining despite consistent training. Or maybe your drive, both in the bedroom and in daily life, just isn't what it used to be. I get it. I've been there. And if you're like most men I've talked to, you've probably heard, it's just a part of growing older. Your levels are normal for your age, or my personal favorite, just eat better and exercise more. But let's cut through the confusion and talk about what's really happening in your body. You see, testosterone isn't just about muscles and sex drive. This powerful hormone affects virtually every aspect of a man's health. It develops and maintains male reproductive tissues, promotes secondary sexual characteristics, maintains bone density, supports muscle mass and strength, regulates fat distribution, and it influences mood and cognitive function. And while it's normal for testosterone to decline about 1% per year after age 30, when levels drop significantly or prematurely, it can affect every aspect of your life. And here's the truth most doctors won't tell you. What they call normal testosterone levels and what actually makes you feel optimal are two completely different things. So let's talk about what low testosterone actually looks like. And you might be experiencing these symptoms: decreased muscle mass despite consistently working out, increased body fat, especially around your midsection, reduced bone density, which you may not notice until it's too late, unexplained hair loss on your body and face, persistent fatigue even after a full night's sleep. You see, I remember looking in the mirror and not recognizing the man staring back at me. My body was changing despite my best efforts, and I couldn't figure out why that was. Sound familiar to you? But low testosterone doesn't just change how you look, it changes how you feel. You might get random mood swings that leave your family walking on eggshells, irritability that makes you snap at the people you care most about, a persistent low mood that nothing seems to lift, brain fog that makes you second-guess your abilities at work, a declining confidence that affects everything from your career all the way to your relationships. And many men tell me these emotional symptoms hit them harder than the physical changes. The mental impact can be profound, transforming how you experience every aspect of your life. Then there's your sex life. Low testosterone often shows up as a noticeable drop in sex drive, difficulty achieving or maintaining erections, decreased semen volume, potential fertility issues, even physical changes in your testicles. These aren't just inconveniences. They can devastate your most important relationships and your sense of self. Okay, so now let's clear up some dangerous myths about low testosterone. Myth number 1, low T only affects older men. The truth? It can affect men of all ages. I've personally seen men in their 30s with testosterone levels of a 70-year-old. Myth number 2, all men with low T need testosterone replacement therapy. The truth? Treatment depends on your unique situation. For some men, lifestyle changes can make a significant difference. Okay, myth number 3, low T always causes erectile dysfunction. The truth? Yes, while it can contribute to ED, there are many other factors that cause erectile issues. Myth number 4, testosterone therapy causes prostate cancer. The truth is, there's no clear evidence that proper testosterone therapy increases prostate cancer risk in men with normal PSA levels. And myth number 5, over-the-counter testosterone boosters are effective. Truth, most aren't regulated by the FDA, and many men report they're ineffective despite bold marketing claims. Listen, this isn't just about how you look or feel in the moment. Low testosterone can have serious long-term health implications, such as increased risk of cardiovascular disease, higher likelihood of developing metabolic syndrome, osteoporosis and increased fracture risk, anemia due to decreased red blood cell production, potential cognitive decline and memory issues. Proper hormone optimization doesn't just improve quality of life. You see, it can potentially extend it. So why aren't more men getting the help they need? Well, the truth is, the medical system is failing men with low testosterone. Most doctors only check total testosterone, missing critical markers like free testosterone and SHBG. Reference ranges are extremely wide, meaning you can be suffering with normal levels. Many doctors dismiss symptoms if you're technically within range. Men are often told symptoms are just aging or it's all in your head. Standard protocols like shots every 2 weeks create hormone roller coasters. And I see this scenario play out every day. Men with clear symptoms being told everything is fine because their numbers fall within an extremely broad normal range. Sound familiar? Let me tell you, you deserve better. Now, you should consider speaking with a knowledgeable healthcare provider if you're experiencing multiple symptoms we've discussed today. Your symptoms are affecting your quality of life or relationships. You have conditions like diabetes or obesity that increases low T risk. You're taking medications that might affect testosterone levels. You've had testicular injuries or disorders. But remember, finding the right doctor matters. The quality of care varies dramatically, and it's worth seeking a provider who specializes in hormone optimization, not just basic management. Listen, you do not have to accept feeling this way as your new normal. So the first step is getting comprehensive testing that looks beyond just basic numbers to understand what's really happening in your body. Proper testing should measure total testosterone and free testosterone, sex hormone binding globulin or SHBG, and estradiol, and other key markers that are important. This isn't about chasing bodybuilder levels of testosterone here. It's about optimizing your hormones so you can feel like yourself again, energetic, focused, confident, and capable. The reality is, optimizing your testosterone isn't just about boosting your libido and strength. It's more than that. It's about leading a fuller, more productive, happier life rather than just existing with low T. You deserve to wake up every day feeling energized, to perform at your best at work, to maintain your strength and health as you age, and to fully engage in your relationships. The first step is getting the right information, which you've started today. The next step is getting properly tested to know exactly where you stand. All right, thanks for watching, and if you found this video helpful, be sure to like and subscribe for more content on men's health and optimization. And drop a comment below if you have any questions at all. We read every single one, and we want to hear from you. Here's to your health and vitality.